Hello, I'm Jordan Kenny and welcome to Coronavirus Catch Up. We're live tonight on the BBC News NI website and Facebook page and also on the BBC iPlayer for the next 20 minutes or so. Now, you'll have heard a lot about COVID-19 vaccines in the past week or two. Last Monday, we heard the news that early analysis of a COVID vaccine made by pharmaceutical company Pfizer found it to be 90% effective. The good news doesn't stop there. Yesterday, early data from US company Moderna showed their vaccine that protects against COVID-19 is nearly 95% effective. So this all sounds great, but we all have a lot of questions, and rightly so. So with me tonight with the answers to some of those questions is virologist Dr Lindsay Broadbent. Hi Lindsay, how are you?
Hi Jordan, I'm good, how are you?
Not so bad, thank you. So first things first, before we get into the questions that have been sent in by viewers, like I said, you're a virologist. Tell me, what actually is a virologist? What do you do?
So a virologist is someone that studies viruses, and there are lots and lots of different types of virologists. You get molecular virologists who really look at kind of the genetic makeup of viruses and how they change, how they evolve, and how they determine how they infect people. You get clinical virologists who study what happens in patients in hospitals, and they do a lot of the testing for viruses. And then you have people like me, and I study really what happens when viruses infect cells. So I look at that interaction between the virus and the host, which in this case is obviously humans, to see kind of what the immune response is. How do the cells react? Do the cells die when they get infected with a virus? Do they start to look different? Lots of really weird, kind of interesting things. And I work really using human cells, which are obviously a really relevant model to study a human virus. So I take cells from donors that have donated their nasal epithelial cells or some of their lung epithelial cells, and I can grow those up and then put the virus on and then really watch what happens to those cells when they're infected.
So in other words, nobody better for us to be talking to about COVID-19 vaccines tonight. We've had loads of questions sent in today. The first one, we'll get straight into them. First one we've had sent in about vaccines. What way do the vaccines come and what are we expecting them to do? So when we talk about vaccines, are we talking about tablets or injections? And once you've had the vaccine, does that prevent you getting coronavirus or does it get rid of symptoms once you've already caught it?
So for most of the vaccines in development for COVID, there'll be injections. I'm not sure if any of them are in another form. So these will be injected into the arm, and then certainly for the two we've heard about this week, Pfizer and Moderna, you'll need a booster vaccine a few weeks later, and that'll really kind of solidify the immune response to this vaccine and make sure that the protection is as good as it can be. Whether this virus causes what's known as sterilizing immunity, so it just prevents you getting infected at all, or if it causes really a much quicker immune response, is still not known for all of the vaccine types, but chances are it'll be the second one of those. And that means that when you come into contact with this virus naturally after being vaccinated, the virus will be detected by your cells, but because you've been vaccinated, your immune response has these things called memory cells, and they'll recognize it straight away, and they'll be able to go, oh, we've seen this before because of the vaccine, and that immune response will be launched immediately, and therefore you won't get any disease, and hopefully the level of virus in your body will be incredibly low because it will happen so quickly, and the hope is that you won't even be contagious because it will have gotten rid of that virus, it will have destroyed it straight away.
So what about in terms of transmission? So say, for instance, you've already tested positive. If you're then vaccinated, can you still pass the virus on to someone else?
So if you test positive, then there is a likelihood that you are transmissible, that you are contagious, and that someone can catch the virus from you. But it's very unlikely if you're vaccinated and the vaccine works and you come into contact with the virus naturally after that, it's very unlikely that there will be enough virus in your system to test positive. As I said, as long as the vaccine works for you, it's unlikely that the vaccine will work for 100% of people.
Well, that's something we'll come on to just a bit later. But before we go to that, in normal times, I'm keen to find this out. How long does it take for a vaccine to be created and then approved for use?
It usually takes a long time. So you're talking between 8 and 12 years on average for vaccine development. And this has obviously happened incredibly quickly. One of the reasons is that scientists around the world, virologists, vaccine scientists, immunologists, they've really all worked together. And I certainly have never known something so collaborative before, that everyone has been really willing to share the information they have, share the technology and the science they have, which is one of the key reasons this has happened so quickly. Now, when you're developing a vaccine, there are certain things that you need to always do. And a lot of those are making sure that the vaccine is safe and then making sure that it also works. And those steps are certainly still being done here. A lot of what was much quicker and what was accelerated here was the development of the vaccine, which usually takes years and years.
So obviously the COVID-19 vaccines have been developed a lot quicker than what would happen in normal circumstances. We've had a lot of questions about that in particular. Have these new vaccines that are in development followed all the same testing and checks as would be the case normally?
They have certainly followed all of the clinical phases that they need to follow. Some of the preclinical stuff was done a lot quicker to accelerate that. So there would often be a lot more work done in the lab before it gets to anywhere near a patient. But for any vaccine, and indeed for any treatment, there are certain clinical phases that have to be done. So the phase 1 trial is about safety. It's given to a fairly small number of people to make sure that there are no adverse reactions, no real serious side effects. And to make sure that they have the dosing right. And that's always given to fairly healthy, fairly young people, so that they just know that the safety is right. Then they move on to phase 2, and that's really about testing it in more people and making sure that they start to get that efficacy data. You know, is it working to prevent COVID? Making sure that the safety is still there. The safety is kind of follows through all the phases of clinical trials. And then phase 3, which we're starting to see results from now, is when it's tested on a lot of people. For example, the Moderna vaccine is now 94.5%, I think, effective from their preliminary data, was tested, I think, on 40,000 people. So huge numbers of people, and then those people go about their daily lives, and then they compare the group that got the vaccine to the group that got a placebo vaccine to see what the rates of catching COVID were within those two groups. And there is a 94.5% difference between the people that were vaccinated and the people that got the placebo. So they know there is a real statistically significant difference, and that's how they know that this vaccine has started to work. There is a 4th phase to the clinical trials, and phase 4 is actually after a vaccine is licensed. They continue to follow people up. They continue to monitor the efficacy and the safety once this has been licensed. And that goes on for a long time. They just kind of do these checks routinely. But phase 4 is an odd one. It's not in the pre-certification and the pre-licensing phase. So it's kind of slightly after that. And I think one thing that's really important is that fairly recently, in terms of science and vaccines, it's now a legal requirement for anyone developing any kind of vaccine to publish their results. So back in the day, 50, 60, 70 years ago, whatever it was, when vaccines were being developed, pharmaceutical companies were a little bit cagier with the data, and that did make people a little bit wary. But now it is a legal requirement that all that data has to go up online. So once they finish their phase 3 trials, we will get to see all that data, and scientists around the world will be able to look at it.
So obviously makes the whole thing a lot more transparent. I should just say as well, if you're watching on Facebook, feel free to send in questions or leave your thoughts in the comment section down below. But Lindsay, you mentioned there's side effects, and that's something that we've had loads of questions sent in about as well. People are interested to know the side effects of any medication, I suppose, that they're taking, but there's a heightened interest around coronavirus vaccine. Then, can we be sure that there will be no side effects with this vaccine, especially in the long term?
I don't think you can guarantee that there won't be side effects from anything. Nothing in this life is risk-free. You can get side effects from paracetamol. People can be allergic to something like water. So we would never guarantee 100% safety for absolutely anything. And I don't think any scientist would. But what we do know is that all of the data that we've got so far is really encouraging. There have been no serious side effects. The only real side effects that have been reported are what you would expect with a vaccine, so things like a sore arm after the injection, maybe a slight fever, or feeling slightly run down for a day or two after that. And that's as a result of your immune system actually detecting the vaccine and starting to work and starting to generate those really important immune cells. As I say, there's been nothing serious noted yet, but that we'll continue to keep an eye on that and make sure that that safety profile stays really promising as more data comes out from these trials.
Yeah, it's obviously reassuring for now anyway. As the news about different vaccines has been filtering through, it's been causing quite a bit of conversation. Some people say they'll be lining up to get it as soon as they can. Others aren't so sure, maybe slightly more reluctant. We've had this question sent in talking about the effectiveness of a vaccine. It asks, does everyone need to take it for it to be effective, or can we just target certain areas of society when administering it?
So we really do need to reach a certain percentage within the community to achieve herd immunity. And we've heard a lot about herd immunity, should we just let this virus run wild? But the safest way and the most reliable way to achieve herd immunity is through a vaccine. And if we want that to happen, we really need kind of 70 to 80% of the population to be vaccinated. For this vaccine, there will be a kind of order of who will be vaccinated, and that will start with the people that are most at risk of severe disease. So those will be, for example, older people, people that have other conditions, other health issues, will probably receive this vaccine first. But we still need other people within the community to be vaccinated because, of course, no vaccine is 100% effective. So if there is one person within a vulnerable community that for some reason the vaccine doesn't work for, we need to limit their risk by getting other people around them, so their friends, their family, to be vaccinated so that they're less likely to catch it from someone else.
So you did mention there are people in vulnerable groups and things like that. We've obviously been told the vaccine could start to be rolled out here before the end of the year. Do we know how this will be done? Will certain people be prioritised first?
Yeah, definitely. It seems at the minute that those that are living in care homes, residential care homes, will get the vaccine first, and then people that are working in care homes. And then after that, it will be based on risk within the population. So those people that are over the age of 80, those people that have quite serious medical conditions, they will receive the vaccine first, and then it will kind of filter down to other people, younger people with health issues, younger healthy people. And at the minute, I don't think there are many plans to vaccinate kids, but I don't know if those plans will change when we have many more doses of the vaccine ordered.
So we've had this one in from Facebook. It's from Michaela Lewis. You can keep me right with this one, Lindsay. I don't know much about live vaccines, but Michaela is asking, are there any live vaccines? And if so, won't they have a shedding period where you can pass the virus on to others?
So for coronavirus, for COVID, the vaccines that we're seeing the results from now aren't live vaccines. Both the Pfizer and the Moderna are both mRNA vaccines. And the Oxford vaccine that we should be getting results of in a couple of weeks it's an adenovirus vaccine, it's called. So it uses a fairly harmless virus, and it takes part of the coronavirus virus and puts that onto the harmless virus to create a delivery system that your immune system can recognize the bit of coronavirus, but it's actually not doing you any harm and infecting you. In terms of other vaccines, there are some live virus vaccines, including the flu mist. So the flu injection that's given usually to kids, the one that they breathe in, the aerosol, is a live virus, but it's called an attenuated virus. So the actual virus itself is weakened, so virologists can go in there and tinker around with it and basically make sure that it isn't dangerous. So it's a live virus, but it's attenuated, so it's much weaker, much less dangerous, and therefore you can still get the immune response without getting sick. The shedding period that people talk about, because these viruses are attenuated, because they're dead or they're altered in some way to make them kind of harmless, any kind of shedding that occurs is not infectious. You cannot catch, for example, the flu from the flu virus, from the flu vaccine, sorry.
There you go. Okay, we will finish with this one. So obviously we've heard the past few days about 2 coronavirus vaccines that are making positive progress during the trial stages. There are dozens more in development. This question, it's from Rachel. It's quite simple. Well, easy for me to say that it's simple because I don't have to answer it. But she asks, why do we need more than one vaccine?
Basically, we don't want to put all of our eggs in one basket. Obviously, we have really good results from these 2 vaccine candidates, but we didn't know that months ago. So it's really good to kind of increase all of your options. There's also things to do with manufacturing. For example, the vaccine that Oxford and AstraZeneca are making can be scaled up quite easily because of the system it is, whereas the Moderna one might be slightly more difficult to make a ton of and to scale up because of the technology involved. So there are different factors involved. And if we can get several vaccines that are really efficient and work really well, it means there are lots of options based on how stable the vaccine is. For example, there are some that won't do well in warm temperatures and need to be kept really cold, like -70. There are some that will be much more stable and will be much more easily delivered to other countries and countries that might not have access to really cold freezers. So there are lots of considerations, but really it's about increasing our chances and not just betting on one vaccine, but betting on lots of them, and hopefully lots of them work.
How optimistic, Lindsay, should we allow ourselves to be about these vaccines?
Judging by the preliminary data we've seen, I'm really optimistic. I think it looks great. I really want to see the final data. These are obviously only interim results that they're releasing now. So give them a few more weeks and hopefully the actual scientific data will be published and we can look at that. But it's really encouraging. I really hope they get these rolled out in the next few months and hopefully people can have their summer holidays next year.
Don't mention summer holidays, you get me excited. But I think that's a positive note for us to finish on. That's all we have time for tonight. Lindsay, thank you so much for coming on and answering those questions. I mean, I'm definitely coming away knowing a lot more about COVID-19 vaccines, and I'm sure anybody that's watching is as well. Thanks to everybody who got in touch. We didn't have enough time to get back to all of you, but hopefully we've helped make sense of some of what's happening this week. Don't forget, you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. But until next week, stay safe.